Hello, my name is WEILONG GU, and my research topic is rush fin and the creation of Medicare and Medicaid. So, the step one for my research will be first to gather background information, which is which is which most important is the payment and payment process for healthcare practitioners needed to be standardized, and treatment costs the economy in the form of direct costs, whereas loss of production is an indirect cost to the economy. Retired workers did not have health insurance. With Medicare, there's more accurate spending on treatments itself, with very little focus, if any, on prevention of disease. There's a need to ensure that Medicare takes care of every American as a form of universal health coverage. In 2018, 20.4 million Americans directly benefited from Medicare. And step two would be to analyze the current situation first. Medicare ensures that medical bills are paid yet fails in ensuring that their high quality of healthcare. Medicare was also transformed to take care of the disabled, convincing doctors to sign up and desgrading hospitals were the greatest challenge faced by Medicare. The greatest achievement for Medicare was to break segregation within the society. The goal of the American Medical Association, aka AMA, is to promote the art and science of medicine along with the betterment of public health. The goal of Medicare is to provide basic health insurance cover to individuals that are aged 65 and above, as well as others individuals that have qualified. And the next issue will be to prioritize issues. There's a highly raising healthcare spending due to high cost of medicine and surgeries being performed. The rapidly aging American population also threatens the existing medical hospital insurance trust fund. Allocation for Medicare should be substantially increased and adjusted for inflation appropriately. Supplementary medical insurance trust funds should also be increased and aggregated further. The Medicare Payments Advisory Committee needs to reduce unnecessary payments and aggressively cut on expenditure. Subsidies should be considered to reduce the cost of treatment. Step 4 is to analyze alternatives. The government can reach a memorandum of understanding with drug manufacturers to control the rapidly rising cost of drugs, increase taxes on alcohol and cigarettes to control the ailments of elderly people that continuously increase the cost of Medicare. Medical malpractice claims can be reduced to provide more funds for Medicare. State taxes on insured should be controlled and kept to decrease spending by hospitals. This saving could be channeled to Medicare. More initiatives should be instituted to improve efficiency in healthcare, while reduce various forms of wastage in the healthcare sector. Step 5 will be providing recommendation for the policies. Policies should be revised to ensure that affordable healthcare is provided to elderly people in rural and regional areas. There should be improved healthcare for workers that suffer mental issues. Funding for public hospitals should be increased. Medicare funds should be invested in better income generating opportunities to increase the value of the kidney. Policymakers can pursue the option of having beneficiaries pay a premium based on their means. The sustainable growth rate system should be enacted to control the payment occurring to healthcare institutions in line of Medicare beneficiary. And for the step 6 would be to it's very important to establish an action plan. Medicare should consult with stakeholders in the healthcare industry to, to ensure that funds are controlled. Policies should be adjusted to ensure that quality of healthcare provided is also well established as opposed to costs only. The government needs to move in and subsidize all medical technology to reduce the medical cost. Medicare, Medicaid, and other agencies should form a committee to address challenges and develop a single framework for improving the quality and cost of healthcare. Quality can be addressed within 3 years, but issues to do with financing will need to be addressed perpetually. And for the conclusion, the current challenges being faced by Medicare cannot be addressed by a single government agency. Both the federal and state health agencies need to jointly consult to find long-lasting solutions. Contrasts between governments, healthcare providers, and other stakeholders in the healthcare industry need to be reviewed for loopholes in the costing format. The government should provide additional subsidies for outpatient drugs and long-term care of patients since these are the highest cost on Medicare. Canada has managed to achieve a high-quality Medicare program by ensuring that the views of all members of the public are taken into consideration in policy making. Canada provides protection of its funds program against the rising physicians and healthcare costs. So this is the end of research, and thank you very much.